during my surgery residency, my chief resident when I was an intern, great guy, still friends with him, and we still operate together actually on occasion. I went to him because I was a little concerned actually. I was concerned that the general surgeons wouldn't look too highly upon me wanting to possibly switch fields. But I said to him, I said to my friend, I said, you know, I'm not so sure this lifestyle is, you know, cut out for me, and I don't really know what to do. I love being a surgeon. I loved being in the operating room, loved operating. And, you know, he said to me, he said, Dave, you know, what you are so good at is being in the operating room, and you know, your skills in the operating room. And he also knew that I was an artist since I was a kid, and he said, did you ever think about plastic surgery? And I really hadn't before then, but it was so weird because this sort of light went off in my head, and I couldn't believe that I hadn't thought of that actually before. Again, I guess maybe I did in saying a long time before that it wasn't for me, but I hadn't recently thought of it. And when he said that, it just sort of, you know, like I said, it just kind of flipped a switch, and I said, maybe that is something I would consider because it's certainly a better lifestyle. And it really, you know, there's not a lot of medical care involved, and it's really about surgery and the operating. And when I was in residency and in the operating room, for me it was like I would be in a surgery and I would just think about how meticulously could I assist with the dissection. And then when we were closing wounds, I was, you know, trying to close them as perfectly and beautifully. It was everything that I looked at was, you know,
I would be like,
almost aesthetic. Yeah, exactly. Exactly. So you know, because my brain sort of thinks in that way, I think that all of a sudden I said to myself, wait a minute, plastic surgery makes some sense. Plus, having been an artist when I was a kid, I draw and I oil paint. And
you're such a good artist. I mean, that's why this is like perfect for you.
Thank you. But yeah, I mean, the minute that he said that, I started thinking plastic surgeon, and I literally never looked back from that moment.
One conversation can literally change like the course of your life. I mean, that one conversation with him planted the seed.
Yeah, and that was when, I think it was when I was an intern. It must have been because he graduated and moved on after that, and he was a fifth year when I was an intern. So yeah, literally for the next 5 years, I was sort of looking forward to, you know, this career in plastic surgery, and here we are.
Well, I'm glad he had that conversation with you.
Yeah, I guess so.
Does he know that? You should tell him that.
I don't know. I feel like I might have mentioned it to him not too long ago, actually. Because as you know, we do cases together sometimes, abdominal wall reconstruction. He's a general surgeon, and he fixes a lot of hernias and that kind of thing. And, you know, I do the sort of cosmetic aspect of it, you know, with the skin and that sort of thing. So I sort of feel like we had that conversation not too long ago, but maybe next time I see him, I'll bring it up again. Did you ever think about being a surgeon, or was it?
That's such a joke.
In reality, it's kind of a loaded question because I know that you in surgery are not.
But actually, I did think about being a surgeon. I really liked surgery when I was in medical school. I did like colorectal surgery, and like I did whatever non-trauma surgery. And I remember like this point that I had to decide, like, do I go down the surgical road or a non-surgical road? And I was really actually very torn because I like the idea of like going in, fixing someone and making them better. It's like very satisfying to do that. And there's a lot of medicine where you can't do that. You give them medication, like my current job, you kind of wait, maybe they get better, maybe they don't. But there's something really amazing about literally taking someone and like taking them into operating room, and then they come out the other side and they're like completely better. But I literally remember having a conversation with my like resident when I was a medical student who was a surgeon. He was going to go off to Mass General to do, I think, thoracic surgery. And I said, I don't know what to do. Like, I'm really torn. And he said to me, he said, listen, he's like, in life, sometimes you literally just have to like make a choice with all the information you have and just go down that path and don't look back.
Yeah.
He's like, it's just like when you get married or whatever. And I remembered that conversation. I remember thinking, he's right. Like I have to take everything I know about me and what I like and, you know, what I think I want to do with my life. And yeah, maybe it's the wrong choice, but I can't keep like straddling these worlds. I have to just choose. And that's what I did. But it was hard. And then even when I went into cardiology, I really liked interventional cardiology where we put stents in, and for the same reason, because it's like satisfying to go in there and like someone's having a heart attack and you basically open up their artery and they're fixed. And so, but I'm not very good with my hands. So that's a little bit of a problem.
Yeah. It's interesting what you say about instant gratification, because you know me, not the most patient person in the world with certain things. And so for me, there's definitely that aspect of it. Like I like to feel like I can control something and that I can fix it. And I kind of need to know that that happened immediately. It's hard for me to sit around and wait to see that happen.
Yeah.
That's just my personality.
I think the thing that was hard for me too about surgery is that you don't always get to build that relationship with patients. And like, so for me, I really like seeing someone again and again over the years, right? And you have that connection. And as a surgeon, you really meet them before their surgery, you operate on them, and then they see you like once post-op and they're kind of gone. Yeah. So that's obviously a big difference in the two worlds. Yeah. But yeah, I mean, so other than the fact that I hate being in the operating room, standing up and not being able to eat for a long time.
Let me just say that if I'm watching, I hate it too.
Yeah.
When I was in medical school and when I was training, just standing there watching was not fun. Like I wanted to be doing and involved. But now, of course, because I am the one doing it, it's great. And what's interesting about that too is that, I can be in there for 6 hours, operating, and it feels like you've been in there for like an hour or two. You just don't even think about the time because you're so focused and honed in that literally you just don't even have any concept of time. So, but when you're not doing it, it's a lot more difficult.
Yeah, I mean, there's definitely an intensity to surgeons that you have as surgeons where you can sit there and focus like that I don't think I have that capability.
But that's why I'm also exhausted afterwards, because you just come down from that, that real sort of tense anxiety of performance. But
absolutely. Yeah.
All right, so I think one last topic or sort of question I wanted to talk to you about, which I think is interesting. I actually had a patient just come in this past week for consultation with me, and she was I think she was concerned. She had been to 2 other consultations, seen 2 other doctors, and she said she didn't really kind of like the experience, and she said she felt like a certain vibe or something when she came, and she just had a good feeling that I was going to be the right doctor for her. And I thought that was interesting because actually I hadn't even quite met her yet. Maybe it was something she read online or something like that. But that's a topic that comes up in this field often, is sort of how do I choose my doctor, right. And what makes a good plastic surgeon. And I'm curious, like, what you think makes a good doctor and what you would be, I guess, looking for in a plastic surgeon if you ever went to one.
If I ever went to one who would operate on me. I think obviously as a doctor, I think it's a really great question. And I always say, like, first and foremost, I think it's someone who just like pays attention to you and like listens, right? And that's true for any field of medicine, but in particular in your field, you want to feel like that person is hearing what you're saying, like you don't feel well and they're listening, or I don't like this about my body, so I think it's just the first thing is just someone who listens intently and that they're invested in what you're saying. And unfortunately, I think a lot of times we've all had experiences with doctors where you don't feel like they're really paying attention. And then I think, particularly in your field, it's about and in mine sometimes, about setting expectations, right? For what is a realistic prognosis or outcome or conclusion to surgery, right? Because you want to give people hope, but you also want to be realistic. And I think in your field, that's difficult sometimes when someone may have in their mind what they want to look like. And then you say, but this is really what we can do for you, right? I can't make you look like Christy Brinkley, but I can make you look like X, Y, or Z. And so I think, that honesty is really important. And then I think empathy is sort of I would say the third thing. So I think like listening, honest conversations, and then like being empathetic, right? A lot of people they recognize when someone cares that they've been suffering or bullied about their appearance. And I think obviously, I'm married to you. You have all those amazing qualities, and that's what makes you such a great husband, father, and doctor, right? When someone sits across from you and the minute they walk in, they see that you're caring, you're listening, you understand what they've been going through, and you're not going to feed them information that's not real. And I think at the end of the day, that builds that connection, and that's what makes people trust you. And it is, the doctor-patient relationship is like a marriage. You really are totally vulnerable. You're naked, you're telling all your fears, and you want to feel that the person that you're exposing yourself to in all these ways is going to keep you safe. And I think you absolutely have that way about you, and it takes 2 seconds of someone hearing you or talking to you or sitting with you to pick up on that. So, I would choose you as my plastic surgeon, but
that's actually sort of the conversation I had with her. I was honest with her. I said, listen, it is very difficult. You see a million different plastic surgeons online, and it's, and it's how do you choose? And some of it, of course, I told her was, you look at before and after photos, and obviously you need to see somebody's work to know if they're, doing good work. And I think that, reviews, obviously, listen, every doctor, even the best in the world, have some poor reviews, which is a shame. We won't go into the reasons why that happens sometimes. But, by and large, obviously, if you've got lots of great reviews, it's not just having the reviews, but I think it's also important for people to read what people have said in those reviews specifically. I personally take pride in the fact that, a lot of people talk about, not just the work that was done, but the experience they've had from start to finish. And it's not even just me, it's everybody in my office. It's, dealing with, Pooja, who's the office manager, because she treats everybody like, gold, and, my nursing staff, anesthesia. So, again, just in terms of plastic surgery, not necessarily your field, but I tell people that they should read reviews, look at the photos, and then I think the last thing you said is sort of the biggest point, which is it's kind of that feeling you get. If you can trust somebody, if they do feel sort of empathetic to what it is your situation is, what they're going through. And I think that personality is not everything, but I think it's helpful in this sort of relationship, meaning if you're a patient, to see somebody that you feel comfortable with.
I think it's a lot. I hear it a lot from people, but people just want to feel like someone has good bedside. Obviously they want to know they're a good doctor and they're talented and experienced and all of that, but they want to know that they can connect with you. And I think that matters a lot.
Yeah, absolutely. Well, this is the end of the podcast, so
can I come back?
We'll see. Okay. I'm going to see if I can get some bigger guests on here. Honestly, thanks for being with us today.
I can't wait to tune in to the next episode.